Welcome to Empowered. I'm Elizabeth Naumovski. She's a history maker, a healer, and a heart specialist in every sense of the word. Tonight, we sit down with Canada's first Black female interventional cardiologist, a woman who's redefined what's possible in medicine. Her story is about breaking barriers, embracing identity, and changing the way care is delivered across cultures and communities. We'll talk mentorship, women's heart health, and how leadership with heart is shaping the next generation. She's redefining what it means to heal with both skill and purpose. Today, I'm joined by Dr. Alexandra Bastiany, who is a doctor at Surrey Memorial Hospital in British Columbia. She's also the Women Empowerment Awards Leadership Award recipient. Empowered partnered with the Women Awards Empowerment Awards, which were held in September 2025. Dr. Bastiany, I'm so excited to have you here today.
And I'm so happy to be here. Thank you for having me.
And you came across the
Yes.
country to
Yes.
be here in person.
Yes, it was very important to me.
Well, it was important to me as well. First of all, congratulations on winning this incredible award. And I'm
Thank you.
so happy that I partnered with the Women Empowerment Awards to have you here today. So let's just begin. You've made history, as I had just mentioned, as Canada's first Black woman interventional cardiologist. What does that milestone mean to you personally? And what does it represent for your community?
Well, I'm definitely very proud of the accomplishment. But I must say, I didn't realize right away how big and how important it was. It took me a little bit of time, and then I saw it. I saw what it represented for the community, for my parents, for my family. And I realized that it was a win, not just for me, but for the whole community. So it was for every mother, every Haitian mother, every Haitian father, every Haitian cousin. Everybody was so happy and proud. And honestly, I think it's all about it. It's all about community.
You know what? That word keeps popping up on
Hmm.
the show. Every single episode, it's always about community. And I love the fact that every woman who's on here actually embraces that. So let's talk about community. You grew up in Montreal as the child of Haitian immigrants. What influences from your upbringing shaped your path toward medicine and your commitment to equity in healthcare?
Hmm. Absolutely. Well, like we were talking about, community is a huge, big value in the Haitian culture. My dad was is still involved with community centers, and uh, he really installed that early in us as children. So I remember when I was a child, I remember I grew up in an underserved community, and I could tell that people were having a hard time to get the primary care that they needed. So every time there was something that was happening, they needed to go to a walk-in clinic. They didn't necessarily have a primary care provider. And I promised myself that I would do everything in my power to be part of the change. So that's where it really came from. It was really important for me to be part of that change.
So, how has being a young Black woman of Haitian descent shaped your work and influence within the medical space?
Um, well, it gave me perspective. I think that having a different background is is a strength. I see medicine as more than just science. Um, every individual is more than just a heart to me. They come with a story. They come with a different background, um, and having that different background gives me that perspective to be able to take care of these patients as a whole. And it's also very important for me to be there with them and understand where they're coming from. I love hearing their stories. I love hearing where they come from. And it just makes everything so much better, really, when you think about it.
I think that's a great Canadian story, though. We've all come from somewhere. You know, Canada
Mm-hmm.
is a country built upon immigrants and stories and community, and we all have something completely different that we bring to the table. And the different is actually a positive. It's not a negative.
Exactly.
When we come back from our commercial break, I want to talk to you about all the navigation that you've had to do, um, because coming from Haiti, you had to change your way of life being here. There were so many other things that you had to learn. And so I don't want to start the next question and cut you off. When we come back, I want to talk about how you navigated and a specialty that wasn't just built upon, with you in mind. So please don't go away. We'll be right back with more. Welcome back to Empowered. I'm Elizabeth Naumovski. Today's topic, empowering women leading with impact. Leading with impact. You were born here.
Yes, I was. I was born and raised in Montreal, yes. But
And-
from Haitian parents, so it's almost as if I was born there sometimes.
But you know what? I totally agree because I'm first generation Macedonian parents. I was born here. And yeah, sometimes, you can't take that village
Exactly.
out of the whole way that you've been brought up.
Mhm.
Okay, so let's talk about you've spoken openly about navigating a specialty that wasn't built with you in mind. What internal or external barriers challenged you most, and how did you push through them?
Honestly, I want to say people. I want to say people, the way people talk, the way people project their insecurities on me, on people who look like me. Med school is hard. Med school is difficult for anyone.
Mhm.
We all have to deal with our internal insecurities, with our imposter
Imposter
syndrome.
syndrome.
So you see me here today. Listen, it took a lot.
Oh, come on. This is fun.
No, but I mean the road to being here with you today, being Dr. Bastiany, it's a long road, and we all have to deal with that. And on top of that, you add the naysayers and the people who don't believe in you, and say it, um, and try to destroy your dreams and tell you that it's not possible. Um, so this having to deal with that adds another layer of difficulty that I wasn't necessarily ready for. Um, the way that I deal with that is mute. I mute the noise. I had to learn to really ignore anything that was getting in the way of me and where I was going.
You're not the first person to say that. I've had other guests on here that said there's so much white noise out there.
Hmm.
And in order to deal and focus, you just mute it out.
Absolutely.
I love the fact that you just said that. Let's move on to representation because that matters, especially in fields where diversity is lacking. How has your presence in interventional cardiology challenged stereotypes? Because this is what we've been talking about. And what impact do you hope it has on future generations?
I want to say that my presence only is challenges everything. There's less than, I want to say, 2 to 3%. There's 2 to 3% women in the interventional cardiology workforce in Canada. Even less Black people. I believe there are two Black interventional cardiologists in Canada. Um, so just the fact that I'm here is a statement in itself. So I want to say that being here is, like I said, is a statement, and it shows to anybody who looks like me. And I want to include Black, Indigenous, Brown students that it's possible, and that it's really important to not listen or not even consider what has been done before. Because if I had stopped to what had been done before, I really wouldn't be here today.
Good for you. I like that. So, in your experience, how does the presence or absence of diversity in medicine impact patient outcomes, trust, and access to care?
Well, diversity is definitely important. I want to say that it impacts the perspective of physicians and also the quality of care. Um, Being able to relate to our patients, being able to see them as a whole, um, in my case, more than just a heart, is important. It increases compliance. So when I say compliance, I mean, are the patients going to listen to the plan, the medical plan? Are they going to take their medication? Will they come back for follow-up? There's a big impact on that, being able to relate to our patients. And when patients have better compliance, they have better medical outcomes. Having a diverse medical force is also very important for our counterparts, our Canadian counterparts, our white counterparts, in a sense that they learn from us. They learn from the different cultures. Being exposed to all this is also very important.
You know, I think learning from everyone, different cultures, different communities is really important. You've got to have that open mind,
Hmm.
regardless of what you do, whether you're a doctor or even someone working at a department store or whatever. We all have to have that open mind. When we come back, I still want to talk to you about gender disparities and other things that have been you've had to deal with in your travels here. Don't go away. We'll be right back. Welcome back to Empowered. I'm Elizabeth Naumovski. Today's topic, empowering women and leading with impact. Okay, let's just jump right in. Cardiology is a field where racial and gender disparities are well documented. So from your perspective, what are the biggest gaps in heart health equity today, particularly for Black women and underserved communities as well?
Um, if we talk about, let's say, underserved communities or underrepresented communities, we know that there's definitely a higher risk factor rate for people of color. Um, we know for a fact that there's more obesity, more hypertension, more diabetes um, in Black and Indigenous patients who went to who were forced into residential schools also have higher risk of heart disease, and this is known. So already there, we're starting with a difference. And if we talk about women, women don't necessarily have higher rates of of risk factors. However, whenever they have those risk factors that we mentioned before, they tend to develop cardiovascular disease more than men. And whenever they get a heart attack, they have 3 times more chance of dying from that heart attack. It's 3 times, it's a lot.
Wow, it is a lot.
Yeah. And everything is worse for Black women and everything is worse for men in general. The other thing that's really striking for me is the awareness situation. It seems like women don't know about the risk of heart disease. They don't know about their risk factors. And up to 50% of women don't know about the symptoms of a heart attack. And that's where I'm working. I'm working to really teach and raise awareness. You have to know about the symptoms so you can recognize them and act when it's
And we're
time.
going to talk about that
Yeah.
in the next.
Mhm.
There's a few more questions. We're going to delve right into that
Mhm.
because that's really important for everyone to
Absolutely.
know.
Mhm.
So you've been a strong advocate for culturally competent care. What does culturally appropriate healthcare look like to you, and why is it so critical for patient outcomes?
I want to say that um, being able to include culture in the way we address our patients is critical. Do I have time for a little story?
You have time for a story.
My mother, had a heart attack a few years ago. She's fine. She's doing great.
Good.
And when she went into cardiac rehab, all our patients go into cardiac rehab to learn about the disease, their condition, to learn how to exercise, what to eat, what not to eat. And she came back home and she was devastated because they had told her that she couldn't eat rice anymore. Rice is a major part of
It's a staple.
it's a staple of Haitian cuisine. So she was completely devastated. They were telling her to eat lentils and stuff like, and she was like, "Alex, I can't do it." And that kind of it was a moment of it opened my eyes because I figured I'm like, well, if you understand the culture, or at least if you take the time to ask their patients, what are you eating? What's a regular meal for you? You'd realize that rice is important. And then how do we work around that and how do we adjust your diet so you can still feel close to your culture and you can also be better, what you eat can be better for your health. So now instead of frying food, we put it in the air fryer. but we still eat our chicken, our fried chicken, but we put it in the air fryer instead.
Right.
So it's little changes like that that make it
Yes.
healthier. But then again, we are still taking into consideration where the patient came from.
But those subtle changes are really important. As you
Yes.
said, they're cultural, right?
Yes.
We eat a lot of stews in the Macedonian community. There's a lot of bread. There's a
Mhm.
lot of everything. And to tell somebody they've got to cut everything out completely, that's devastating to them.
It is. Food is culture, and that's just one example. That's just one example. There's a lot of it's a g- religion is a big thing in Haiti, for example. So there's a lot of belief in a higher presence, and so whenever something happens, a lot of it is attributed
To God.
to God
Right.
and the evil. And so I think that meeting our patients halfway with our science and their beliefs is critical if we want to bring them on. We can have the biggest plan, the most, you know, the best medical plan for our patients. If they don't follow, it's not worth it. It's not worth anything.
Don't go away. We'll be right back with more. Welcome back to Empowered. I'm Elizabeth Naumovski. Today I'm joined by Dr. Alexandra Bastiany, who is at Surrey Memorial Hospital in British Columbia. And she's also the Women Entrepreneurs Awards Leadership Award recipient. And so let's just continue because I want to talk about women's heart health.
Yes.
We touched upon it before. Heart disease is the leading cause of death in women. What do you wish more women understood about their heart health?
Two things. I really would want women to be an advocate for themselves. It's clearly we're not being taken seriously by the health system. Unfortunately, it's still the case. Women need to understand their risk factors. They need to be aware of what the symptoms of heart disease are. Whenever we go to the physician, sit down, ask them, what are my risk factors? What are the symptoms of a heart disease? Do I have risk factors that could put me at risk? What is my risk of heart disease? How do I reduce that risk? These are simple questions that I teach to my patients and to online. Ask these simple questions, and that will make a huge difference in how you carry yourself in this world to prevent cardiovascular disease.
So let's take it to the next level. What are the symptoms?
So the symptoms of a heart attack, let's say, for example, would be we would have the chest pain. So that's the typical presentation that we call. We have the chest pain, the arm pain, the jaw pain. It can radiate to the back, and then the sweatings, the heavy sweats. These are all symptoms. Shortness of breath. These are the main symptoms that people will usually report. Now, women have the same symptoms.
Okay.
The difference lies in how they report their symptoms. So men will come to the emergency and say, I have chest pain. I'm not feeling good. I'm going to pass out. Women will talk about all of the other symptoms, the symptoms that are kind of secondary: headache, dizziness, um, the heavy sweats that we were talking about, tummy ache. They wouldn't necessarily use the same words that a man would be using, and sometimes it makes it that there are oversights. They're not considered to they're being considered as not having a heart
Right.
attack. So I teach women how to recognize these symptoms and also express them in a way that they're being taken seriously. It's so sad that we have to do that, but it's necessary.
Mm-hmm.
So now that the recognizing a heart attack it's being automized. It's more machines that look at the ECG, and
Right.
so now that we have a little bit more of of machine, uh, how can I say that?
Machine learning,
L-
machine.
the machines are looking at the ECGs to make a
Mhm.
diagnostic. Now that we have that part in the diagnostic, women there's less gap in recognizing heart attacks in women and men, but there's still a gap
Yeah.
in the treatment as well. Women tend to go to cardiac rehab less often than men. There's so many reasons for that, but they're not even referred as often as men. So there's still a lot of work to do.
No, there is a lot of work to do. So many women carry heavy stress. We carry a lot on our shoulders: careers, caregiving, community, responsibility, ambition. What practical evidence based heart health practices should every woman prioritize, regardless of age, background?
We have to move. We have to move. Yes. It can be as simple as going for a walk. So the current recommendations are 150 minutes at least per week of moderate activities. We're talking brisk walk, cycling, or 75, at least 75 minutes of heavier activity like swimming or
Cardio?
jogging, cardio.
Mhm.
That's it. And it doesn't, I always tell my patients, you don't have to go hard. Even if you go 10 minutes per day, you start by 10 minutes, next thing you know, you're walking 30 minutes.
Yes.
Just start. Just
Move.
do something. Just move.
Just move.
Just move.
Well, thank you so much. This has been wonderful. I'm so happy that you came into the studio. It was so
Thank you.
wonderful to meet you. And I hope that our paths cross again sooner than later.
It will.
Yeah,
Thank you for having
absolutely.
me.
Dr. Bastiany wants you to know every time a woman steps into her power, she creates a path forward. Stay committed to your goals and do whatever it takes to make yourself proud. I'm Elizabeth Naumovski, and I'm here to empower you and make frugality fashionable. Thank you so much for watching. Bye for now.